So tonight we've got a second workshop, community workshop that's focusing on mental health in multicultural communities. These workshops have been funded by the Department of Health as part of the implementation of the recommendations from the Royal Commission into Victoria's mental health system. So we've been really pleased to partner with the Department of Health, and I did see Helen Chong here from the department. So nice to see you, Helen. I might defer to Rashmi rather than sort of improvising from here. So Rashmi is our policy and advocacy manager and has actually worked to bring this event to you tonight. So over to you, Rashmi.
Thank you, Chris, and apologies that our chairperson is having some technical issues with getting into the meeting. I'd also like to acknowledge the traditional owners of the lands that I'm joining you from. I'm joining you from the lands of the Wurundjeri people of the Kulin Nation, and I'd like to pay respects to their elders past and present and acknowledge that they've never ceded sovereignty over this land. I'd like to welcome everybody. Thank you for making the time to hear from our speakers tonight. I'm Rashmi. I'm the Policy and Advocacy Manager here at ECCV. I've been working with some of our colleagues to bring this forum together. And I'd like to welcome and thank our speakers. So I'll talk a bit more about them in a few minutes. But they are Jaya Manchikanti, Hala Nur, Tigist Kebede, and Shehani De Silva. Thank you for making the time to speak tonight. And I'd also like to welcome Thabani Tshuma, who will be performing his award-winning poetry. So we're pretty excited about this event and we're excited to welcome you. I'd just like to remind everybody that we're actually recording the session. So if you'd prefer to keep your camera off, that would be fine. I'd just like to give you a bit of housekeeping. So we'll be first hearing from our speakers, and then we'll have time for questions at the end. And when we do have our question and answer time, please use the raising hand function if you'd like to ask a question. If you prefer to keep your camera off, then you'd be welcome to message one of the ECCV team. And if you prefer to raise your question anonymously, you can ask the team to read out your question. So in lieu of Eddie's opening comments, I'd just like to emphasise that what an important priority mental health is to the ECCV. We've been working to contribute to the Royal Commission and to the mental health reforms. And I'd also like to acknowledge the support of the Victorian Government to bring this forum together. And the importance of this discussion is probably highlighted by the number of people who've shown interest. And we also acknowledge that at the moment, the current pandemic and the current restrictions that we're all living under are a significant mental health challenge, especially for the diverse communities who are affected by current outbreaks. So we hope that some of the reforms and some of our contribution can help to address those challenges. And we'd like to be working with as many people as possible to make that happen. So as part of the context for this event, I'd like to acknowledge the Victorian Transcultural Mental Health as an organisation that's been leading in this space for a long time. We collaborated with them earlier this year to develop a paper on the policy reforms needed in the mental health system, for the mental health system to become more culturally responsive. So I'd really encourage everyone who, if you haven't already had a chance to take a look at the paper. And I'd also like to acknowledge our Executive Officer, Chris, who you just heard from. He's actually leaving us, finishing up next week. He's actually driven some of the work that we've done around mental health, and we will miss him. As he mentioned, this is the second of 2 forums that we've held about mental health. In the last forum, we heard from government, from Parliamentary Secretary Steve Demopoulos, and we've also heard from service provider and clinical perspectives. And in this forum, we'd like to hear from people with lived experience, from grassroots community perspectives. And to open tonight's forum, we have a special performance by spoken word poet Thabani Tshuma. He's a Zimbabwean writer and performance poet, and he's been published in publications such as Dichotomy magazine and Next in Colour. He was the 2019 Grand Slam champion in the Slamma Lamma Ding Dong competition, and he's ranked amongst the 50 top slam poets worldwide at the IWPS in 2019. He's been the winner of the Melbourne Spoken Word Prize. So I'd like to thank him and welcome him to perform a piece for us tonight.
Thank you, Rashmi. And thank you to ECCV for hosting this event. Thank you to the speakers. I'm excited to hear from you. And thank you to everyone who's here tonight. So I am broadcasting from Nam on the unceded lands of the Wurundjeri people. And this first piece, I guess it's concerned with the concept of narrative, because poetry is intrinsic to my mental health practice in ideas of introspection and kind of seeing myself in my truest form. It's one of the reasons that I was drawn to it as a space to creatively play and a space to connect with other people. So this first piece is called Your Story. This particular persona was not cast to play the part, but I am a legendary hero. I've been sailing through misplaced history as one of the ancient Argonauts in outer space, battle-ready, sword in hand, adjacent to a band of warrior brothers. I fleeced the gold from the sun's rays to make this spacesuit armor, stitched the stars themselves into the seams, and to my delight, breamed brighter than any myth recounts. But I found that incandescence was only on the outside. My internal is a misplaced story, an epic that seeks a hero inside. We're all just stories. So I have this box. I try to take it most places, and on various occasions will work it into any conversation. It's filled with stories. Nothing marvelous to look at about yay high, regular story box size, scuffed on most sides by the mileage of mishandling. You could hold it in the palm of your hand or pop it in your breast pocket, enclose it in a locket laying by that picture of someone you'll always love. Remember their story? How they smiled, sunshine, speak in symphony, and smell like seconds before rainfall. The memory of them is in this box. It doesn't lock or have a lid, no barriers to stop the countless stories pouring in. But the weird thing is, they're not my stories. See, I'm somewhat of a storyteller, which I'm often told is no way for a fella to make a living. I spend my days retelling lives. If you say it fast enough, it sounds like telling lies, but aren't lies just stories enough people believe? I want to put my truth inside that box, but it's either lost or incomplete in a time long before my monomyth began. Found in the sting of skinned knees, in cold feet hesitant to take seemingly large steps, but that remember how it felt to press against warm legs. If you hear aversion, of my story. Write me with an inkless pen, on paper felled from fears, in books bound with the bonds of family and friendship, where one is sometimes stronger, but neither sticks longer than it needs to, if you need to. Believe that I was more than the things I did. Keep me in your own story box, not as the man, but as the myth. This is my gift to you. And in exchange, I'll draw your story from my story box too. Let it spin whispers of inspiration around fires on frigid nights. Tell of your triumphs and your plights, recounting all the moments in the beauty of your life. I have this box. It's filled with stories. Inside it, you'll live forever, and with it, we'll change the world. So tell my story. Maybe this one is one of yours. Thank you.
Thank you, Thabani. That was an excellent way of opening our forum tonight with the theme of narrative and personal journeys and stories. And I think also hearing from you just highlights how much our community's creative and cultural resources can be such effective ways to address mental health and promote wellbeing. So we'll be hearing another piece from Thabani shortly, after we hear from a couple of our speakers. So it's my privilege to introduce our first speakers tonight. They'll be speaking about their lived experience, and as well as talking a bit about how that's contextualised in terms of the social determinants of mental health and wellbeing. So I'd like to welcome Jaya Manchikanti, who's the founding and current president of IndianCare, which is a welfare and community development organisation for people from Indian origin in Victoria. Jaya's been working in social services and across the government and not-for-profit sectors for over 20 years. At present, she is a PhD candidate with Victoria University, doing research on the role of community development in sustainable development. And she'll be telling us a bit about her personal journey today. Our next speaker after Jaya will be Hala Nur, who is a youth worker with Thabani. She's focused on early intervention and prevention for children aged between 5 and 16 years. She's been an active member of the Inner Northwest Melbourne African community. She's currently studying to complete a Masters of Social Work, and she's been involved in a number of recent community volunteering project work. So I'd like to welcome Jaya and Hala and invite them to share their stories with us.
Okay. Thank you, Rashmi, and thank you, Thabani. Good evening. I'd like to begin also by acknowledging the traditional owners of the land on which I stand, the people of the Kulin Nation, and I pay my respects to their elders past, present, and emerging. Please allow me also to take this opportunity to express solidarity with members of the Afghan community. I hope that you know that many of us here care for you and the plight of the people in your country. I thank the ECCV for organising this forum and for taking a lead in advocating for inclusive mental health reforms in Victoria. I'm also thankful to the Victorian government for holding a... I'll just wait till that's muted. Thank you. I'm also thankful to the Victorian government for holding a Royal Commission into Mental Health in 2019 and for accepting the 65 recommendations that came thereafter. I particularly welcome recommendation 42, which is about developing a new Mental Health and Wellbeing Act to replace the old Mental Health Act. The addition of the word well-being is a more holistic measure and can lead to better outcomes, especially during these pandemic times. Tonight, I'll share my personal journey, and I'll try to do so in alignment with the findings of the Royal Commission report, especially recommendation 34, which is about working with diverse communities. I must admit that I've only looked at the findings in a cursory way, but I have read enough to recognize that my story has some connection to it. This is the first time that I have chosen to speak publicly about my mental health episode, which occurred 15 years ago. I have never felt that I need to talk about it publicly, although at that time of my illness, my psychiatrist did say that once I get better, I could write a book about it. I thought he was playing a joke on me because I could hardly get out of bed, let alone put pen to paper. I have no intention to write a book. However, I do feel the need to contribute to this once-in-a-lifetime opportunity to improve the state of mental health care in Victoria. I want to say that this is my story, and I'm in no way speaking for anyone else, as mental health illness affects people in so many different ways, with so many different outcomes. My story was during a non-pandemic period, and I'm well aware that what I went through was in circumstances that were not as desperate as these days. My interest in the mental health reform is located more at the primary prevention and early intervention end of the spectrum. Of course, tertiary intervention is critical, and clinical care needs to be delivered in a culturally and linguistically sensitive manner. However, as a community development trained worker, my approach is always to try and prevent problems starting in the first place and addressing systemic issues that cause people to become unwell. As such, I will touch on these types of reforms. In 2006, I was diagnosed with major depression, also called clinical depression. It caught me by complete surprise, as I thought I was coping well in life. However, when I found myself in tears unexpectedly day after day, I went to see my GP. The doctor immediately diagnosed it as depression and gave me a script for tablets. There was no explanation and no further commentary. I could not believe that diagnosis. I was in denial that I had a mental health illness. I resisted taking the tablets. This is the first issue I want to raise. The shame and stigma attached to a mental health illness was strong within me. This is how society views mental illness. There is so much taboo around it. If I had told people I had a heart condition, there would be no such stigma, and I would have had many well-wishers surrounding me. We need to destigmatize mental ill health in our communities. If not, this will remain as a tremendous barrier for seeking assistance. Mental ill health needs to be normalized, similar to physical health problems. Community organizations and community leaders have a big role to play in mental health education, if provided the resources to do so. I resisted taking tablets for close to 2 months, and I've heard that this is not uncommon. I tried to manage it with lifestyle changes such as exercise, healthy diet, meditation, and music. And while these were all useful and I follow them now consistently, it was not sufficient at this crisis point. I had deteriorated to an extremely bad condition. A GP was no longer sufficient, and it needed the intervention of a psychiatrist. I was referred to a psychiatrist who, knowing that I was not able to keep up my paid employment, very kindly only charged me Medicare rates. This was a blessing. And this is the second issue I want to raise: costs of mental health care. It needs to be affordable and available. Otherwise, this is another significant barrier. I finally agreed to taking medication, but the first 3 types of tablets didn't work. It was only the 4th variety that started to take some effect, by which time many weeks of intense pain had to be endured, as each antidepressant medication takes 2 weeks to settle in, and if there are no signs of improvement, then it takes 2 weeks to wean them off. I cannot tell you how excruciating the mental pain was while I was waiting for the right medication. Thankfully, I had a loving and patient family to get me through that difficult time. I remember my daughter putting a gold star on the calendar each time I did not wake up crying in the morning. The mornings were always the worst time of the day. I found myself terribly isolated while I was diagnosed with this condition. There was an intense feeling of loneliness, although I had the support of my family. I needed to connect with people who were in a similar situation, but there was nowhere I could turn to for this support. This is the third issue I want to raise. We need more facilitated peer support groups. This type of intervention is so necessary. I did go through talking therapy with a psychologist, but that was only for short periods of time, and it didn't address the strong need to talk to someone who was going through a similar mental health condition. Over a period of 10 months, I was slowly on the way to recovery. I eased myself back into paid work and eventually got off the medication 18 months after I started taking it. The illness was a turning point in my life. I questioned what had caused me to become so low, which rendered me completely helpless, not only mentally, but also physically. I have spent a lot of time reflecting on it, and I've come to the conclusion that was partly due to physiological reasons, but also due to social reasons. Being a migrant child who came into Australia and settled in regional Victoria in the 1970s, there was a fair bit of racism and social exclusion that I had faced in my formative years. That, coupled with expectations and intercultural complexities, led to an identity crisis that needed much unpacking and resolving. The trauma of this journey, I believe, led to a buildup of pressure that just lingered until midlife, which when combined with physiological changes led to a complete meltdown. So this is my fourth issue. We have to address systemic issues such as racism and social exclusion. This is primary prevention work. Otherwise, the damage caused by racist taunts, lack of inclusion, and distress of navigating different cultural contexts can cause mental health issues that can last for a very long time. These issues need to be addressed along with other systemic issues, such as barriers to employment, housing, education, and health. Governments and other agencies must work with ethnic communities to address these systemic issues. It needs to be a partnership approach for it to be effective. The multicultural sector should be compensated to provide their cultural intelligence to addressing these problems. I truly believe this would lead to a positive, sustainable outcome, similar to what we have witnessed recently during this COVID period, where governments have relied heavily on community groups for support. My message, therefore, is to, 1, address the biggest system problems that diminish people from reaching their full potential. 2, destigmatize mental ill health so that people can seek help early. 3, provide more peer support activities for people who are mentally distressed. And 4, make mental health care accessible and affordable. I want to end with this final message. It is a simple message and can be readily carried out by everybody if we choose to do so. That message is kindness. A simple act of kindness can go a long way. A welcoming smile, gentle words, patient listening, and a generosity of spirit can do wonders in making people feel included and keeping positive mental health. Thank you.
Thank you so much for sharing, Jaya. We'll now hear from Hala, who will also talk about her own lived experience.
Hi, thanks guys. Thanks, Jaya, for that. I would like to start by acknowledging the traditional custodians of the land on which we are on today, the Wurundjeri people of the Kulin Nation, and I would like to pay my respect to their elders, past, present, and emerging, and acknowledge that sovereignty was never ceded. So I'm gonna talk about my own experience, lived experience with the stuff that's kind of been happening right now with the pandemic. So I work at a communal playground called the Veni, where, like Rashmi had mentioned, we work on early intervention and prevention. Where I work, we're in close proximity to the towers. So last year, during the lockdown of the 9 towers, and we did 2 weeks of amazing work, if I must say myself. And then unfortunately, I contracted COVID and I was required to isolate for 2 weeks. So during that time, I was obviously living by myself. Well, I had to move out from my parents' home and live by myself, which I'd actually never done before. So it got a bit shaky for me while I was there. While I was there, my mental health was impacted a lot. There was obviously a lot of stuff happening on the ground that we were not kind of dealing with at the end of the day, that I was kind of bottling up. And when I got to do my 2-week isolation period, everything just completely just crumbled. And my thought process was literally just eating me alive. Like, I was thinking about everything that was happening. And I think there was a lot of trauma for sure, considering the stuff that happened, whether it was with other orgs or whether it was with Victoria Police. And my mental health was affected. I didn't really know how to deal with it, because I think it's not something that we really talk about in our communities. Like Jay had mentioned, there is a lot of stigma attached to mental health. And unfortunately, it was one of the things that I'd never had to deal with before. I was also one of those people that just kind of used to like brush it off a little bit and be like, oh yeah, it doesn't happen, you know what I mean, to everybody. So, but when it came to my turn and I had to deal with my own mental health, I realized that I had never seen a psychiatrist. I had never gone to a therapist. I'd never gone to a single counseling session to talk about anything. And I'm a 29-year-old, you know, and I've never sat down and talked about my experience, which is a bit of a issue. And I had realized that then. And then I realized the importance of speaking to people in those professions to ensure that everybody is, able to get the right help that they need when they need it. And I actually needed it then. So once I've completed my 2 weeks, that was the first thing I needed to do, is I needed to speak to somebody to kind of just talk about everything that had happened. And what I found the most easiest and the most comfortable thing for me to do was to speak to somebody who looked like me. Somebody who was able to relate to me, to relate to some of the experiences that I lived. And I think that's one of the issues that we have in a lot of the mental health services, is that there's not a lot of people who work, there's not a lot of people that work in the mental health industry that look like me or that are available to speak to people like me. So for me, I always say that I think it's important for larger organizations to employ people that have a relationship, or they are able to relate to the demographic that they're wanting to serve. So it makes it a lot more easier, because they're aware of the stigma that's attached to mental health. And I think that's a vital thing. And I think it shows the progression where eventually people are able to seek services and to go there, because I think that will make it more comfortable. I would feel more comfortable and understand and be able to go to a service and be like, oh, okay, well, this person is going to be able to understand why I think there's a stigma attached to it, why it's so shameful, and why we don't talk about it. And the reason why we don't talk about it is because our parents don't talk about it, and their parents don't talk about it. And there's this thing that is, people who suffer mental health issues are, you know what I mean, unwell, and you know what I mean, crazy in a sense. Unfortunately, that's the term that gets used, but for them, they don't know any better. And as people as I migrated to Australia, so somebody like me to be 29 years old and to not know the value and the importance of speaking to somebody who's able to help me was a big eye opener for me. So it's something that I do encourage. And I tell a lot of people that, you know what I mean, that I know, or guys, see a therapist, and like, what? And I was like, it's the best thing ever, because I feel like it really helps me as a person, whether it's supervision, whether it's speaking to somebody about the things that have happened to you in your life, because we also forget that there's intergenerational trauma, you know. So I think it's employing people that are able to provide the service to the correct community is key. I know currently right now, there are a lot of people in the towers who unfortunately are isolating, and due to the isolation, everybody's mental health is actually exacerbated. And we are just finding out now that people are suffering from more than just, you know what I mean, depression and anxiety. There are people who are living in the towers who unfortunately could possibly be suffering from psychosis, but they never knew that they were suffering from any sort of mental health illness till now. And this is the time where I feel like we need to reach out to community and ensure that we're providing them with the best service that we can, because you don't only have to educate the person who's you're seeing, but also their families and their families. And I think that's probably one of the most important things that we could do right now. So for me, I think it's key. And yeah, that's it. Thank you.
Thank you, Hala. Really would like to thank you for taking the time to speak to us tonight, knowing that there is currently an outbreak in public housing and that there are many people who are affected at the moment with having to isolate. So we'll hear a little bit more from Jaya and Hala after we hear from our speakers. But before I move on, I'd like to invite back Thabani to share another piece with us. So thank you, Thabani.
Thank you again, Rashmi, and thank you, Jaya and Hala, for sharing your experience. This last piece, it's well placed in the program lineup because it essentially is a lived experience piece, my lived experience. I've been in recovery from addiction for going on 5 years now. And an integral part of my work is shifting the conversation around addiction because I come from a culture. Sorry, can you hear me? I come from a culture where mental health isn't discussed as openly, and I use poetry and I use my work to kind of give insight into my experience, but also create a sense of relatability where other people can look at my work and be like, I feel that too, and resonate with that. So even though this is a mental health space, I have a duty of care as an artist to share a content warning that this piece deals heavily with themes of addiction and death and loss. So if you need to do anything to keep yourself safe, please do so. I think safety of spaces is of utmost importance. So I wrote this piece a couple of years ago, and it is called The Sixth Sense. The first movie with a major plot twist I witnessed was The Sixth Sense. When, spoiler warning, we find out Bruce Willis's character was dead the whole time. That specific twist is a trick I learned to live my life by. You see, to me, addiction is a haunting, a relentless search for peace by someone who has long been deceased. It's a stillborn self-image clawing for a breath of life. It's making bedmates of death's darkness. So step into my shadow, where a needle prick, pill drop, or whiskey shot acted as a rusty crowbar, trying to pry open my soul to feel something, to feel anything at all, anything but dead. Days became nights, became weeks, became years, searching to feel alive. So of course, I took to poetry, to hitting line after line after line, after lying to myself, after battling denial after trying to put together the scattered jigsaw fractal pieces of my mind. I'm trying to be honest these days, trying to tell my story like it is, unfiltered, triple distilled, just how I like it. I mean, liked it, I'm ashamed of how much I liked it, of finding an ecstatic sweet relief and how it mattered more than living, mattered more than loving, and all it leaves is longing. One more hit, one more sip, just one kiss, just tonight, just forever. They say we spirits live forever. What that means is that the dying never ends and the living is spent pretending, covering up the pooling crimson quagmire of that fatal wound, blending in as one of them who assume him. There's no way he could be consumed by phantom antics, and if he is, call it possession, a phase, an escape, anything to lessen the waking funeral truth. I buy into it too. Walking both sides of this realm, an abject detective solving my own murder. I am both Sisyphus and the boulder, at the precipice of perception, both I and the beholder. It's impossible to hold the incorporeal closer. I spend my days hugging wraiths. I faced my inner demons to be haunted by the ghosts of overdoses. I still hear them screaming, Thabani, call me, Thabani, hold me, Thabani, save me. I cannot save you. I'm dead too, but I don't know it. Getting clean has been a graveyard. I'm a groundskeeper frantically digging, measuring 6 feet while shoveling 12 steps. I keep digging and digging and digging. The past won't stay buried, but my friends do. We specters don't remember who we were before we died. I'm trying to recover that. There is no call to action, no solemn catharsis, no sympathy for the strung out. I'm just a kid with a blanket pulled to his chest, talking to ghosts. And I wonder if anyone looks at folks like me, croaking that ghastly gasp to ghouls that goes. I see dead people. Thank you.
Thank you. Thank you, Thabani. Might give everyone a moment to take in the performance before introducing our next speakers. We'll now hear from our next speakers, Tigist Kebede and Shehani De Silva. And I'd like to also invite Jaya and Hala back, who will join us as a bit of a panel to discuss some of the themes that we've heard about and talked about so far tonight. Tigist is a counsellor with the Victorian Foundation of Survivors of Torture, otherwise known as Foundation House. She's worked in the field of complex trauma, particularly in the areas of family and domestic violence and sexual violence. Tigist is a passionate advocate for equitable practices and employing anti-oppressive and intersectional lens. She's also a counsellor at Polar Psychology, and she works in both voluntary and professional capacities in her community. Following Tigist will be Shehani De Silva, who is an education and service development consultant with Victorian Transcultural Mental Health, which is the lead transcultural and intersectional mental health service in Victoria. Shehani has worked overseas prior to migrating to Australia in Sri Lanka with organisations such as UNICEF Sri Lanka. She's interested in building service capacity to address intersectional community needs as part of her current role at VTMH. So we will have time for questions after we hear from our speakers, and I'll moderate the discussion. So yeah, I'd like to invite now Tigist to speak to us and share some reflections.
Thank you. I feel very, oh, am I still on mute? No. I feel very lucky to be speaking after such amazing speakers, but also very overwhelmed because so much raw and impactful stories that we've heard, all different perspectives of what people's lived experiences have been. I'd also like to begin by acknowledging the traditional owners of the land that I'm meeting you on here through Zoom. I'm meeting you on the Wurundjeri and Bunurong lands of the Kulin Nation. I acknowledge the connections that these people have with land, with the community, with the waters and the air, and that their land remains unceded and sovereignty is unceded. And I would like to acknowledge any traditional owners here today, any past and emerging as well. As well as sending out my solidarity with the people of Afghanistan. I think it weighs heavily on a lot of our minds, and definitely working in Foundation House, we can definitely see the impacts of what that's going to be for the Afghan people here in Victoria, as well as those who will arrive. I don't know really where to begin. So many themes were talked about today. And I think I was just writing some notes on the side as it was happening. And, you know, one thing that continuously came up, whether it was from Thabani at the start or Jaya and Hala's commentary, was around their stories and how their stories on both sides have impacted them, whether it's while they were going through something or while they've kind of moved away from that. And when we talk about the Royal Commission, one thing that continuously comes up for me, especially working in a Black-owned practice, one of the only ones in Victoria, I think in Australia, that's Black-owned and by African and Indigenous women who lead it, is that when you have a different experience to the norm, so whether you are racially different, whether your gender is something that's different, whether it's the way you present or your religion, your experience in particular around mental health, but also your lived experience in this world is going to be different as well. And one thing that I've noticed, especially in the context of COVID, because I believe that COVID has amplified the already existing inequalities that have cemented themselves systemically in this country and in this world, is that things such as race, while that is not a social determinant of health, racism is. While religion isn't a social determinant of health, Islamophobia is. While gender isn't, sexism, transphobia, and misogyny is. And these are what people's experiences are like that lead them often into having mental illnesses or experiencing stress and anxiety. And that is where we start, by having these experiences, whether it's Jaya's example of experiencing racism, whether it's Hala's example of responding to the towers and being confronted with police officers, with trying to respond to a community who were detained and not knowing how to help people that look like you. So it is these experiences that cause people to have stress, to have anxiety. And then once they journey from this place into an institution or many institutions, that these social determinants exist within them. whether it's what Hala said of people not looking like them and not speaking the same languages or having the same cultural understandings, or Jaya said in terms of an expectation of talk-based therapy, the expectation that I need to enter a room and have these conversations, when in many communities, healing doesn't occur in individual spaces. It occurs within your community. It occurs within cooking. It occurs within social practices. I know in my community, it occurs over coffee, and it occurs through sports. And we have a system right now that's deficit-based, that measures you based on the worst things that happen to you. That says, oh, okay, when was the last time that you experienced family violence? Or did you get hospitalized for that? And yes, I understand the need to understand risk. But if we have a deficit-based system, I think the expectations of deficits means that people don't get treated unless their deficits are high enough or big enough that we believe that they need to be seen. And people's relationship with systems begins when there is something happening. Not that there isn't that trust occurring where I attend a mental health facility only when I am sick, only when I am unwell, compared to a lot of the community systems or a lot of the non-Western approaches where health and well-being exist as part of the ecosystem of the community. That the people that you would get help and support from, you are getting help and support from before you are unwell. You have these relationships with them. And these things are not necessarily the, by the time you get to them, the worst case scenario. And like what Hala said, oh, I have to be quote unquote crazy to be able to speak to a doctor when something happens. And I think what ends up happening is we looked for these solutions, which is, hey, just get someone who has a hijab, or get someone who has dark skin or speaks 2 languages, not understanding that is a great start, but we cannot change these systems by starting from the bottom. We actually need to start from the top. Because what happens when you get a hijabi wearing woman into an organization that, because of maybe their first time that they've ever had someone like this, don't have the structures, the policies, the procedures in place. So this person leaves the organization, and the turnaround and their poor mental health means that they end up coming to someone like myself at Polar Psychology. And we by far support significantly a huge population of people who are helpers, who supports these helpers because the system isn't created to acknowledge their diversity. They do not have managers who have these learnings, and their managers learn at the expense of these people. They're learning what racism is while they're being racist. Or they are learning what sexism is as they're being misogynist. And what you have is, you have these people that leave. So when we talk about how do we reform, we need to reform from the top down. Reforming by looking at our Medicare system and wondering who it includes and who it doesn't include. And what practices are we deeming approved and appropriate and what isn't, whether it's peer-based, whether it is in language, or whether it is seeing community work as work, bicultural work as work, and putting the structures in place to support that. You can't hire bicultural workers without ensuring that they have bicultural practices and policies to support them, that support their burnout. That when Hala's getting a call at 12 o'clock at night saying, help me, that there are structures in place if you are going to hire her. So I think when we look at, what reform looks like, I love to hear that we are hiring more people, we're increasing that diversity. But what are we placing on these people that we hire? Are we not changing the system within that to ensure that these people have adequate supervision, that these people have adequate, and the people who are supervising them, what are they being trained? The organization that is in there, who are the people that are their CEOs? Who are the people that are on their boards? What are we funding? What are we saying is valid and not valid? And really, if we attack this from a top-down approach and look at going, how do we acknowledge the top while also acknowledge the bottom? I think that's when we can truly start looking at reform, because reform doesn't happen by hiring Aboriginal people, but not acknowledging the systemic influences that impact their well-being. It doesn't happen by simply hiring a Black girl and expecting her to speak every language and sing every song and have her as a picture on every brochure. So I think, you know, I feel like I'm emphasizing this point very thoroughly, but I really, as someone who provides support for helpers, as someone who provides cultural debriefing for bicultural workers, and see the level of burnout and the level of unpaid work that they do, I think that this is part of what the reform needs to look like. I'm done, but I can't hear anything. So I don't know if you guys can hear me.
Thank you, Tigist. Yes, I can still hear you. We really appreciate your reflections, especially about the needs of the workforce, and particularly bilingual and bicultural workers who have a lot of expectations placed on them. I'd like to invite Shehani to join us now and share a bit as well, and reflect a bit on the key themes that we've heard about tonight.
Thanks, Rashmi. Thank you, ECCV, for having us today at this seminar. And I also would like to begin by acknowledging the traditional custodians of the land on which I'm